my name is Carla. I'm going to be your nurse for today. I have some orders from your provider to get some assessments on you. Is that okay?
Yes.
Alright, so I already checked your vital signs. So what I'm going to do first is just ask you some questions. I just want to ask, do you have you had any headaches lately?
No.
Do you have any blurred vision?
No.
With your ears, is there any ringing in your ears? Are you hard of hearing?
No.
Do you have any problems breathing?
No.
What about any problems swallowing?
No.
Alright, so next what I'm gonna do, I'm gonna check your pupils first, okay?
Okay.
Alright, so if you can just look up into the corner up there. Okay, so your pupils are equal and they're round and they are reactive to light and they also accommodate to it. Alright, so next I'm going to do is I'm going to assess your head, okay? I'm going to check for any lesions or any nodules up here, okay?
Okay.
Alrighty. Alright, so I'm going to check for symmetry with the ear. Okay. Alright, there's no drainage coming out of there. And then, okay, so next what I'm gonna do is, can you just hold your head straight for me? Okay, and can you just, is it okay if I touch you?
Yes.
Okay, and can you swallow? Okay, alright, so I'm gonna start with your range of motion, okay? Alright, so I'm gonna have you hold your arm out. Alright, so I'm gonna have you just flex your arm in and then extend out. And then I'm gonna add some resistance to it to test your tone, okay?
Okay.
Alright, so I'm gonna have you flex in,
Okay.
and then and then I'm gonna have you flex again, and then I'm gonna check your tone extending. Alright. Okay, and now I'm gonna do for your wrist, I'm gonna have you hyperextend, so bring your wrist all the way up. And then just extend, so straight out, and then I'm gonna have you flex, so go all the way down. Okay, and I'm just gonna check the resistance. Alright, I'm gonna have you push up for the resistance, all the way up. And then I'm gonna have you push for the resistance, and then I'm gonna have you flex down. Okay? Alright, I'm gonna do the same thing on the other arm, okay? So, alright, so now flex for me, and then extend. Right, I'm gonna add some resistance to flexion. Alright, now flex. Alright, and I'm gonna have you flex again. Alright, and I'm gonna touch your resistance to extend. Okay. Alright, and now for your wrist, I'm going to have you hyperextend. Alright, now extend, and then flex down. Alright, now I'm gonna test your tone. To extend, and now all the way up. And now flex down for me. Okay. Alrighty, now I'm going to do the same. Alright, so I'm going to check your range of motion for your knees and your ankles, okay? And I'm also going to check the tone or resistance as well. Alrighty, so I'm going to have you extend this knee out. Alright, and then flex it back in. Okay, and I'm going to test your resistance, so I'm going to have you extend it. Okay, and now I'm going to have you flex back in. Okay, and now I'm going to go ahead and do your ankle while I'm on this side. Alright, I'm going to have you bring your ankle up a little bit. Okay, and now I'm going to have you point to the ground, plantar flexion. And then I'm going to have you point up, dorsal flexion. Okay, and I'm going to test your resistance, okay? Alright, so I'm going to have you point down to plantar again. Okay, and now I'm going to test your resistance going up. Alrighty, now I'm going to do on the other leg, okay? So I'm going to do this knee now. Okay, so I'm going to have you extend and then flex in. Now I'm going to check the resistance, okay? So I'm going to have you push out to extend. Okay. And I'm going to have you push out to extend again. Alright, now flex in while I test that resistance. Okay, good. Alright, now I'm gonna do the same for this ankle, okay? Alright, I'm gonna have you point up for dorsal flexion again. Alright, and I'm gonna have you point down. Now I'm gonna test the resistance. Alright, point up again for dorsal. And then for plantar, go down. Alright, well that looks Ow. Well that looks good, okay? Alright, so next what I'm gonna do is I'm just gonna go ahead and check your heart, okay? Alright, so I just have to ask, have you been having any chest pains? Anything like that? Alright, so actually what I'm gonna do first before I check your heart is I'm gonna check your jugular vein for any JVD, okay? So I'm gonna shine this light on your jugular vein. So turn to the left for me, please. I'm gonna assess this at a 45-degree angle. Okay, now the other side. Alright, that looks good. Okay, and next what I want to do is I want to check your capillary refill, so can you hold your fingers out? Okay, capillary refill is less than 2. Alright, and next what I'm going to do is I'm going to check for edema bilaterally on your upper and lower extremities. So can you hold your arms out for me while I check for edema? Alright, I'm going to do the same on your legs. Okay, well everything looks good there, and then I'm going to, gonna check your heart, okay?
Okay.
So I'm gonna check your aortic valve, and then your pulmonic valve, and then your Erb's point, and then your tricuspid valve, and then your mitral valve. And that all sounds good. And then I'm also gonna check your pulses bilaterally too. So I'm gonna check your radial pulse bilaterally. And then I'm gonna check your dorsal pedis pulse bilaterally. And then your posterior tibial pulse bilaterally as well. And I also am gonna assess your apical pulse for a full minute, okay? Alright, so after that, I'm gonna go ahead and do a respiratory assessment on you. Is that okay?
Yes.
Alright, so what I'm gonna do is I'm gonna listen to your lungs. Have you been having a cough lately or
No.
no cough? Alright. So you haven't had any sputum or anything?
Just some green sputum.
Oh, some just green sputum? Okay. So I'm also going to educate you on the use of an incentive spirometer as well as the turn and cough method. So what you're going to do for the turn and cough method is you're going to turn on your side and then just force a cough out. It's going to help expel some of that sputum out to help clear your lungs. And then for the incentive spirometer, you're going to take this, and this is going to expand your airways. It's going to strengthen your lungs. It's going to help you also get the mucus out. So what you're going to do is you're going to take a big inhale. It's going to expand your lungs, and then blow out into the incentive spirometer, okay?
Okay.
Alright. So I'm going to check your lungs now. I'm going to check your right upper lobe, and then your right lower lobe. And I'm going to check laterally, and then your left upper lobe, and then your left lower lobe, and then laterally as well. And then can you lean forward for me? I'm going to check the right upper lobe again, and then the right lower lobe posteriorly, and then laterally, and then the left upper lobe, and then the left lower lobe, and then laterally again. Alright, so everything sounds good. So the last thing I want to do is I want to I'm gonna have to ask you. I'm gonna check your gait, okay? Your balance and everything, and your stance. So I'm gonna have you walk from this side of the room all the way to the door. All right, that looks good. And then coming back to the chair, I want you to walk heel to toe. All right. And then last thing I'm gonna do is I'm gonna check I'm gonna do the ROM assessment. So I'm gonna have you just balance for a few seconds. All right, so no swaying, so you're good. All right, you can take a seat. Have you had any joint pain or any broken bones or no?
No.
Alrighty, so that's all I have for you today. So your provider will be in with you shortly, okay?
Thank you.
Alright, thank you.